I became a thoracic surgeon for a number of reasons. I think probably the most important is that diseases of the thorax are complex and necessitate long-lasting relationships with patients and necessitate sort of a multidisciplinary approach. So we get to work with a lot of different teams. We perform complex surgeries and take patients through very difficult periods of their life. And so from that aspect, it's very rewarding and something that I'm really glad I went into. Sarcomas are a group of cancers that arise from specific tissues that are distinct from the cancers that you see and are aware of, things like lung cancer or esophageal cancer. So these cancers are distinct, they're rare, they have a tendency to affect people of all ages, in particular younger individuals and even children on occasion. They are a challenge to treat, and surgery forms a central part of that treatment. While they typically don't originate in the thorax, they can, and for that reason, thoracic surgeons play an integral role in the management of sarcomas. But even for sarcomas that don't originate in the chest, for example, the extremity sarcomas that we see, sarcomas of the leg, sarcoma of the arm, sarcomas of bones elsewhere in the body, which is the area that they most typically involve, they can often spread to areas of the chest. And so the role of the thoracic surgeon in the multidisciplinary approach to the treatment of sarcomas is extremely important. Here at the Montreal General Hospital, we have an excellent multidisciplinary team led predominantly by the orthopedic surgeons here, given that most of these tumors involve the bone. But as I said, thoracic surgeons play an extremely important role, and this is a rapidly evolving field. So the management of sarcomas typically, like I said, centers on surgery, but also involves new chemotherapies, radiation therapy. And here at the Montreal General Hospital, we have sort of an integrative program whereby we're able to look at patient tumors, grow them in the lab, and potentially tailor our treatments. So that's a new and exciting field and something that's rapidly developing here, and something I'm happy to be a part of. The treatment for sarcoma is variable and multidisciplinary. Surgery remains probably the mainstay of treatment, so taking the lesion out. But like I said, it's a multidisciplinary approach, and sometimes it can involve chemotherapy, and often it'll involve radiation therapy. And those are given in particular orders depending on the way that patients present with their disease. So the mediastinum is just a fancy way of saying the structure or the space between your lungs. So it's that middle part of your thorax right here in which you have your heart, your trachea, your esophagus, and a few other organs, some strange ones, things like the thymus. And there's a number of diseases that are specific to that part of the body. And so we have a tendency to categorize diseases anatomically, and one of those anatomic sites is the so-called mediastinum.